Morning guys, myself Sandeep Kumar Reddy from Ingenious Competitive Training Academy. Today I will be discussing about the CRPF Staff Nurse Sub-Inspector previous year examination paper. Initially we have the mathematics of 10 questions and followed by the general knowledge and general science, that is bio questions, which have been given. The total of 100 questions we have. Among them the 2 hours will be given. So you have to complete all the 100 questions within a time of 2 hours. So let us see exactly what it has been given in the slides. The average of 5 numbers is 27. If one number is excluded, the average becomes 25. In this what happens is the total of 5 numbers is what? 27 into 5, that is 135. If the one number is excluded, then the average becomes, that is 25. So 25 into 4 what? That is 100. So out of 135, 100 is deducted, then the answer will be 35 is the right answer. That is 35 is the excluded number, whatever it is required. It's a easy type of questions you have to prepare. For the mathematics it's very easy. You can gain the 10 marks. The average score of a cricketer for 10 matches is 38.9 runs. If the average for the first 6 matches is 42, then find the average for the last 4 matches. As in the given question, the total of the 10 matches runs is, that is 38.9 into 10. So that is 389 runs are the total runs. Among them first 6 matches has been given, that is 6 into 42, average is 42. So 6 into 42, 252 is the runs of first 6 matches. So out of 389 runs, if 252 is deducted, they will get the answer as 137 for the rest of the 4 matches. So in that case 137 divided by 4, the new average is 34.25 is the new average. Next we have 3/4 of a number is 60. The number is, in this case whatever has been given, 3/4 of x is equal to 60. So in that case x equal to 80 is the right answer. That is the number which is required. Now again we have been given that number when multiplied by 15 is increased by 196. So in this case what happens is, if the number is x, if it is multiplied by 15, then the number is increased by what? That number x plus 196, increased by 196. So now the answer is 15x is equal to 196 plus x. In that case 14x equal to 196 is the right answer. So x equal to 14 is the right answer. It is, everything is depends on the terminology. Next we have 3 numbers are in the ratio. The numbers are 4:5:6 and their average is 25. The largest number is, so we knew that 4x, 5x, 6x are the 3 whatever the numbers. The average has become, that is 15x by 3. So that is 4x plus 5x plus 6x divided by 3. That is the 15x by 3. So in that case directly whatever the average has been given, that is 25 has been given. So now we have the x is 5. So largest number among them, that is 6x. So you can directly 6 into x, that is 6 into 5, that is 30 is the largest one. If they ask the smallest, 4 into x, that is 4 into 5, 20 is the smallest number. Next we have, at present the ratio between the ages of Arun and Deepak is 4:3. After 6 years, Arun's age will be 26 years. What is the age of Deepak at present? So as usual Arun and Deepak has been given as 4:3. So in this case after 6 years, so the Arun's age has been given as 26 years. Before 6 years, that is 20 is equal to 4x. That is whatever the ratio has been given. So when 4x equal to 20, x equal to 5 as the answer. Now we have the 3x is the present or past age of the Arun, that is 15 years, 66 years before. What the now is 21 years is the present age of the Deepak. Next we have 18 years ago a father was 3 times as old as his son. Now the father is only twice as old as his son. Then the sum of the present ages of the son and the father. So in this case what exactly has been given is, father and son has been given 3x and x. So now the whatever has been given, the directly 3x we can directly as father and son, the ratio is 3:1. So in this case next we have the 2:1. So in that case what happens is, the initial difference of 3 and 1 is 2. Now here 2 and 1. So the difference is varies. So you have to multiply that difference, that 2 with this 2 here, next ratio, then directly new ratio will become 3:1 and 4:2. This is one process, guys. You can directly go through my playlist where you will find the way of solving this. So now the new ratio has come, that is 3:1 before, now is 4:2. So now whatever has been given, that 4 plus 2 is, that is sum of the present ages of the father and son. So now the total has become as, that is 6 into 18. So directly you will get that 108 years is the total answer. Next we have the price of a car is 3,25,000. It was insured to 85% of its price. Now the car was damaged completely in an accident and the insurance company paid 90% of the insurance. What was the difference between the price of the car and the amount received? So in this case what happens is, the cost price whatever has been given, 3,25,000. So now the total percent is 100%. If the 1% is asked, then directly 3,250 is the right answer. Then whatever has been given, it was insured to 85% of its price. So that 85% is 2,76,250 is the right answer. Then what is the difference between the price of the car and the amount received? So here whatever the insurance company, that 85%, among this 85%, that is again 90% has been insured. So that 90% of that, whatever 2,76,250, so is equal to 100%. Then 1% is 2,762.5. So you can directly figure out what exactly has been given. You can make the answer. So 90% is 2,48,625. Now they are asking the amount received is, as you can see here, what is the difference between the price of the car and the amount received. So here the amount received and the difference whatever has been asked, 3,25,000 minus 2,48,625, you will get the answer as 76,375 rupees is the whatever the insurance difference. After deducting a commission of 5%, a TV set costs rupees 9,595. Its market price is, we knew that whatever the commission has been given on the market price, that is 100% is the market price. You got the discount, that commission is 5%. Now the selling price has become 95%. So now whatever the selling price, that 95% has been given, that is equal to 9,595. So 95 into 101 you will get as 9565. It means that 100% into 11, that directly 101, that directly goes to whatever has been given, that is 10100 is the right answer whatever has been given. In an election, a candidate who gets 40% of the total votes is elected by a majority of 476 votes. What is the number of votes polled? So please remember guys, here whatever has been given, the winner has got 84% and the loser has got 16%. Now the difference between the winner and loser is, that is 68%. Whatever the 68% we have, that 68% is equal to 476. The 10% is equal to, here directly we can, that 1% is equal to, easily we will get that 7, because 476 divided by 68 is equal to 7. Now the 100% is equal to, so we will get directly the answer as whatever has been given here. The 700 is the total votes. I request you guys to check playlist and share it to your friends. There are more than 800 plus question papers have been given, which are very useful. You can even join on Defense ICTA, which is very important. You can directly go through this, and we have the playlist whatever has been given in the segregated manner. You can directly go through this. Next we have, the country has clinched the maiden women's Kabaddi World Cup championship title. We knew that Indian women's team had won recently that maiden women's Kabaddi World Championship title. Next we have the railway minister, that is Piyush Goyal at present is the railway minister. Before it was different. Whatever the questions have been asked before, I am telling the same question, but the answer is at present Piyush Goyal. The state with no sea opening, it means that state has no coast at all. It means that is Bihar. We knew that Gujarat, Andhra Pradesh, these are all some coastal areas, but not the Bihar. According to the Constitution of India, who has the power to remit the death sentence? We knew that the President of India has got the power to cancel or remit the death sentence of the any personal in any kind of activity. Next we have, according to the Constitution, this he is also known as the Supreme Commander of Armed Forces and first citizen of India. The sex determination tests have been banned by Prenatal Diagnostic Technique Act. We knew that whatever the determination of sex has been fully banned because the fetus of a woman child are going to kill. Even in Haryana that is happening, which is very bad. Because of that sex determination that has been banned by the Prenatal Diagnostic Technique Act. Can a child under 7 years of age be arrested? No, 7 years of child cannot be arrested because he is small. He has to be taken care of by the parents. Husband and wife have a right to each other's company. The right is known as matrimonial right, because once they get married, they have a right to stay together. That is known as matrimonial right. Under this matrimonial right, they will be given the marriage registration certificate. The women's regiment of the Indian National Army was called Rani Jhansi Regiment. We knew that whatever the INA which was formed under the Rani Jhansi Regiment. The Bharat Ratna award not received by Atal Bihari Vajpayee that time, but the Sachin and the Bismillah Khan as well as CNR Rao, everybody has got the Bharat Ratna award, but not the Atal Bihari Vajpayee. A sudden fall in the level of mercury in a barometer indicates that there is a stormy weather which is going to happen. That sudden fall of level of mercury. Next we have, when a bottle of perfume is opened in one corner of a room, the smell spreads throughout the room. This is an example of diffusion. We knew that the maximum diffusion takes place by the nitrogen which is kept in the thermocol. That is the one which directly gets diffused, but not the same manner. The same perfume bottle also works on the principle of diffusion. Thermostats maintain a steady temperature. They are used in the refrigerator, automatic electric irons and ovens. In these three, the refrigerators, automatic electric irons and ovens, among these three, these thermostats will be maintained the steady temperature. The ice just melts. There is a change in temperature. Along with the temperature, volume will be changed and the state will be changed. Now we have the value of the square root of 0.4. That is, you can directly, very easy questions is to please have a practice. Next we have, a general wishes to drop his 36,581 soldiers in the form of a solid square. After arranging them, he found that some of them are left over. How many are left? This is you have to identify. Please go through whatever the ways of asking your questions with the friends or your seniors. Next we have, the protein found in soybean is called, that is, we will find the maximum protein. That protein in soybean is called leucine. The food group of the following is basic food group, that is, wheat and whole grain are the food group which are basic food groups. High rays entering the eye is controlled by, we knew that whatever the intensity of the light is defended by the pupil. Next we have, the cranial nerves have the highest number of branches, that is, vagus nerve is the one which has got the highest number of branches. The side effects of Haemophilus influenza vaccine is urticarial. This is what you have to remember. Whatever the side effects of Haemophilus influenza vaccine, that is urticarial. Next we have the growth, the reproduction and the organ system. These are all the features of life will be taken place, but not the responsiveness. Next we have, the odinophagia is a pain during swallowing. We knew that whatever the pain during the swallowing, that is known as odinophagia. The condition is less likely to cause stomatitis, that is heart failure. Please remember, what are the condition that is likely to cause stomatitis, that is heart failure. Hematologic abnormalities includes anemia. Please remember whatever the abnormalities of hematologic, that includes anemia. Gallows fraction is used for what? The fracture of shaft of femur. This is known as gallows fraction, which is used for the fracture shaft of femur. The lifestyle factors are most closely related to bladder. That is, as you can see, the lifestyle factors are most closely related to bladder cancer. That is, smoking 2 packs of cigarettes daily. If you start taking the maximum intake of cigarettes, that is of the 2 packets, that directly affects your bladder. Next we have the enlargement of thyroid glands occurs in hypothyroidism. Next we have hypothyroidism and tumors of thyroid. This is what you have to remember. So whatever the enlargement of thyroid gland, that occurs in this tumors of thyroid as well as hypothyroidism. The priority of nursing assessment in the first 24 hours after admission of client with thrombotic CVA, that is pupil size and papillary response. This is what you have to remember. What are the priority of nursing assessment in the first 24 hours after admission of the client with thrombotic CVA? The condition is the most common form of hyperthyroidism is Graves' disease. Please remember what are the condition is the most common form of hyperthyroidism is Graves' disease. Next we have an 83-year-old woman has several ecchymotic areas, has right arm. The bruises are probably caused by what? That is increased cavity capacity, fragility and permeability. This is what exactly in this you have to remember. The highest risk for potential hazards from the surgical experience is what? That is 67-year-old. They have got the highest risk for potential hazards from the surgical experience. Next we have Karan has been diagnosed with the aplastic anemia. The nurse monitors for changes, that is in peripheral sensation. You will find that the drug should be withheld in hemodialysis, that is antihypertensive is the one which should be withheld in hemodialysis. After a long leg cast is removed, the male client should report any discomfort or stiffness to the physician. Next we have the nurse should instruct the client to eat grains to obtain the best supply of vitamin B12. Please remember, we should remember that whatever the vitamins we have, cyanocobalamin is the one, and we have this. The medical condition is commonly found in clients with bulimia nervosa, that is allergies. So whatever the condition is commonly found in clients with bulimia nervosa, that is allergies. The following symptoms is common in asthma, that is we can see wheezing takes place during the time of asthma. The most common site of cancer in children will be in the area of bone marrow, you will find in the children. The adverse reaction may occur with the administration of erythromycin, that is nurse and vomiting. This is what exactly which happens, the adverse reaction that may occur with the administration of erythromycin. Next we have the function of the kidneys. We knew that what is the functional unit in the kidney? Heparin. The actual function of this kidney is the formation of erythropoietin as well as maintaining of water balance and acid balance. What are the maintenance? That maintaining, but not the formation of the urea. Urea will not be formed in the kidney. Next we have the indication that fluid replacement for the client with hypovolemic shock is adequate, that is systolic blood pressure greater than 110 millimeter mercury. Next we have atropine sulfate, that is atropine is contraindicated in all but one of the client with, that is glaucoma. We knew that what are the problem concerning to glaucoma, that is one thing you have to remember. Atropine sulfate, that is atropine is contraindicated in all but one of the client, that is with the glaucoma. This is the one you have to remember. The water is there in the form of liquid in cells of our body, that is 70% of the water we have. The period of ovum is from conception to, that is 2 weeks. Please remember whatever the period of ovum, that is from the conception, that is to 2 weeks. The height of healthy normal baby is near about 18 to 20 inches is the height of the normal healthy baby. The development of starts with the head and gradually proceeds to the tail portion. This principle of development is known as what? Cephalocordus development. This is what? Cephalocordal development is the one. In this case what? With the head and gradually proceeds to the tail portion. This principle of development, this is what exactly we call. The pre-adolescent age is, that is between the age of 12 to 14 years is the one which is the pre-adolescent age. Next we have the intense emotions are expressed with creative and cultural acts which is known as mental catharsis. This is what? Intense emotions are expressed with creative and cultural acts, that is called mental catharsis. Next we have megaloblastic anemia, which is caused due to the deficiency of folic acid. Please remember, whatever the megaloblastic anemia, that is because of the deficiency of folic acid. Patient suffering with the high blood pressure should be given, that is less sodium diet has to be given for the patient who is suffering with the high blood pressure. Anti-Beriberi factor is known as, that is vitamin B2 is the one which is anti-Beriberi factor. The thick yellow milk secreted by the mother just after 2 days after delivery, that is we should remember that colostrum is the one, the thick yellow milk secreted by the mother just after 2 days after the delivery, that is colostrum. The age group, the requirement of vitamin A, that is retinol, is least in which in the old age people you will have the retinol content is very less. We have the RDA of vitamin D, that is calciferol for a pregnant lady according to ICMR should be 10 mg or 400 IU. This is what exactly you have to remember. The RDA of vitamin D for a pregnant lady according to Indian Council of Medical Research should be 100 mg or 400 IU. The main product of protein metabolism is urea. Please remember what are the main product of protein metabolism we have, that is urea. The minerals are required for the human body, that is near about 24. Normal systolic and diastolic, we knew that what are the 120 systolic and diastolic is 80 millimeter mercury, that is measured in the sphygmomanometer for the adult guy. That range is the one. Diarrhea, dermatitis and depression are the symptoms of pellagra. What exactly the symptoms of pellagra? Diarrhea, dermatitis and the depression. These are which are the symptoms of pellagra. A baby lifts his hands hearing hard voices are called morostatus. Exactly you have to remember, a baby lifts his hands hearing hard voices are called morostatals. Next we have the milk is nearer the mother's milk when added some sugar and extracted some fat from cow. Please remember, whatever the content of the cow here, whatever the milk is nearer to the mother's milk when added some sugar and extracted some fat from cow is the which is very good one for the children. Lysine is found in which place? We will find in milk. This lysine is found. Maximum source of energy in our body is, we take the maximum source from the carbohydrates only. Polydipsia, polyphagia and polyuria, these are the symptoms of what? Diabetes. We knew that what are the diabetes which occurs because of the less insulin which is secreted by the pancreas. So that is the one. Polydipsia, polyphagia and polyuria, these are the symptoms of diabetes. We have the vitamin B3, that is niacin. I already told vitamin dual, cyanocobalamin, vitamin B1 you should remember, B2, B3, everything you have to remember. Marasmus disease is caused due to the deficiency of protein and calorie. This is what you have to remember. Because of the deficiency of protein and calorie, this marasmus disease will occur. Next we have the rupture of tubal ectopic pregnancy is treated surgically by salpingectomy. This is what the rupture of tubal ectopic pregnancy. In fetal distress, that is found in amniotic fluid, that is meconium. Please remember, in fetal distress that is found is, that is amniotic fluid, meconium, you will find this. Fertilization of ovum normally takes place in ampulla of fallopian tube. Please remember guys, here what you have to remember is, whatever the fertilization of ovum normally takes place in the ampulla of fallopian tube. McDonald here whatever McDonald suturing is done in the recurrent abortion. We knew that during the time of recurrent abortion, this McDonald's suturing will be done. Next we have binovular twins form from 2 ova and 2 spermatozoa. So these are the things, binovular twins, which are formed from the 2 ova and the 2 spermatozoa. Next we have the increased pulsation felt through the lateral fomites at 8th week of the pregnancy is Osiander's sign. This is what exactly to remember. Next we have the chronic gonadotropin is secreted by, as you can see, please go through whatever the abbreviation has been given, name has been given. Implantation of fertilized ovum outside the uterine cavity is known as ectopic pregnancy. Causative organisms of syphilis is, that is, Treponema pallidum. The following pelvis is usually associated with what? Transverse, that is android. Next we have the permanent cessation of menstruation, that is menopause. At the age of 55, the woman will get the permanent cessation, that is further no menstruation will be taken place. The purpose of doing fourth maneuver is, that is to have an idea what the fetal part is. Next we have the levonorgestrel is used as an emergency contraceptive. We have next, fetal position is most favorable for birth, that is posterior position of heat. This is what exactly you have to remember. Contraceptive oral pills help in birth control by preventing ovulation. The test tube baby is the fertilization outside and gestation inside womb of mother, which is exactly to be remembered. What are the test tube baby is the fertilization outside and the gestation inside the womb of a mother, which is taken place. We knew that this is one type of, at present, whatever is happening. The most important of oral contraceptive agent is progesterone, is the one which is the most important of oral contraceptive agent. The amniocentesis or withdrawal of allochonic fluid from pregnant woman. This is what exactly amniocentesis means, withdrawal of allochonic fluid from the pregnant woman. The terms are used to describe the thinning and shortening of the cervix that occurs just before and during the labor is effacement. What exactly the effacement is? The terms are used to describe the thinning and shortening of the cervix that occurs just before the during the labor. This effacement takes place of this vagina. The complications are possible with an episiotomy, that is prolonged dyspareunia. So please go through this, whatever the complications are possible with the episiotomy. Next we have one of the complications of hypodermis, as you can see here, gravidarum is increased vomiting. Next we have the greenish yellow color of amniotic fluid indicates post maturity. That is what you have to remember, post maturity, that greenish yellow color of amniotic fluid that indicates. The placenta should be delivered in within how many minutes after the delivery of the baby? That is 30 minutes. Oxytocin causes what? All except lactogenesis. Premature separation of normally situated placenta is called as abruptio placenta. This is what exactly premature separation takes place. So these are the few questions, guys. I hope all these questions which have been covered from the previous paper. This is my mobile number. You can call me or message me. If you want 2100 PDF of GK and GS, you can directly call me. Feel free to call. Thank you. Have a good day. Have a great life.